Namaste. I am Dr. Ramya, consultant endocrinologist, Apollo Hospitals Visakhaptnam. So I am here to speak a couple of words about obesity on the occasion of World Obesity Day, which returns on March 4 every year. And the theme for the year 2022 is everybody need to act. So it was like obesity is a major public health issue the world is facing now. It's a very challenging problem. It's a multifactorial disorder. And we are in the pandemic of obesity for the past 40 years. In the world, about 800 million people are affected with obesity, and many more millions are at risk. The most alarming thing is increase in the risk of childhood obesity. Childhood obesity is increasing for the past 4 decades and adds on to this pandemic, which make the children confined to home even without outdoor activities and more to these screens, leading to a drastic increase in the childhood obesity for the past 2 to 3 years too. And here the main root cause is especially the food. So there is an aggressive marketing and promotion of processed food, which is less nutritious, more unhealthy, and is more affordable. It was like previously in the Western lifestyle, and now due to increase in the processed food, there's an increase in the obesity even in low and middle income groups. So where are we? We need to redesign our food system to prevent the children, the youngsters, for leading to developing obesity. Obesity is not a simple disease. It's associated with the major comorbidities like diabetes, hypertension, and dyslipidemia, and also increased risk of cardiovascular disease. And so in the recent times, the obese people who are affected with COVID-19, there is an increased risk of hospitalization and associated morbidity and increase in mortality. And here, so besides food, genetic factors definitely plays a role. They accounts for about there are 40 to 70%, but to this, the environmental change needs to add to increase the risk of obesity. Along with it, we know the lifestyle events, we will be surprised to know that even prenatal means the child in the womb, and also in the infancy factors also influence the adult obesity. It was like the child is severely malnourished in the womb itself, that leads to childhood obesity, and if it's a big baby due to gestational diabetes, that also leads to childhood obesity and also adult obesity. We don't know that, and we need to address these factors too. The growth of the baby itself in the womb also influences the obesity. That is very surprising. And the other factor, in women with each pregnancy, there will be a retained weight of approximately 2 to 3 kgs. And sometimes it was due to many hormonal changes in the menopause also, but it's not proven. But there is a redistribution of the fat. So besides this, mental health. Mental health is very important. So if the individuals have any mental disorders, there will be an increase in depression that leads to increase in cortisol that adds on to weight. Besides this, sleep pattern. If we don't have a proper sleep and we have night shifts or something, there will be again increase in the cortisol, increase in ghrelin, and decrease in leptin. All these also leads to obesity. And the drugs which use for obesity, like antidepressants, antipsychotics, and sometimes, of course, steroids for childhood asthma or something, also are one of the risk factors for obesity. And finally, coming to the healthcare, most of the individuals don't accept that the obesity is a disease. So that needs to be addressed first. They need to accept that the obesity is a disease and that needs to be treated. And the other thing is, even if they come for the treatment, the main barriers are economic constraints. So they need a personalized diet pattern, regular physical activity, and the anti-obesity drugs or surgery that needs to be addressed is also have a major economic burden that leads the individuals away from the treatment for obesity. And finally, the stigma. The stigma of obesity itself makes the individuals depressed and elevated stress levels, again cortisol, and leading to obesity. And it was like the obesity in Indian and Asian setup is different from the Western society. It was like in Western societies, they consider BMI, that is height for weight, more than 25 as overweight. But in Asians, it was like they have a more of abdominal fat, which is more dangerous and more lipolytic, and that leads to metabolic syndrome even with a BMI of 23. So in Asian setup, the BMI more than 23 is overweight, and more than 25 is obesity grade 1, and 30 is obesity grade 2. We need to know these differences because depending upon the grades, the medical treatment and surgical treatment varies. It was like when the BMI more than 35, they need to have a surgical procedures even without associated comorbidities. And if they are in a grade 2 with a BMI 30, they need to have a medical management that we need to address to the patients who comes with obesity. And finally, the only proven treatment for obesity is definitely lifestyle modification, which includes dietary changes and more of physical activity. You know, dietary changes contribute to 70 to 80% of change in our weight. And of course, physical activity contributes to approximately 30% of change in our weight. And coming to the diet, there are empty number of dietary like plans available in the net now. But finally, we need to follow a pattern which has low calories, low carb. And we as an endocrinologist don't encourage very low calorie diet, which we call Atkins diet or ketogenic diet. The whatever diet we follow, that we need to have a consistency because it's not a single day thing. We can do the ketogenic diet for 25 days or 30 days and lose approximately 10 to 15. But that is not important. What is important is whatever lifestyle we follow, that need to be like consistently followed, because like once the patients stop eating that ketogenic diet, they regain all the weight they lose in the like a couple of months back. So the most important thing we advise is whatever dietary pattern you follow, that need to be followed with consistency, and it should be a low calorie. Low calorie means whatever we eat should be 500 calories less than whatever we spend. Low calorie and low carbs, and that should be followed consistently, which should have more of vegetables, fruits and protein and less carbohydrate. And finally, a physical activity which includes cardio, like it's not walking that always helps, that should be have a cardio like jogging, swimming, skipping, whatever, that will be also helpful. So the finally, as an endocrinologist, my word is whatever lifestyle you follow, that should be followed with consistency, persistently, with a low calorie deficient diet and a regular physical activity. And we here are there to support you both emotionally and also medically. So those who really need a medical management, we are here to help you, and we are here to have a personalized diet plan and also motivational support. So my word is stay consistently in maintaining your weight. And even we are in an overweight stage, try to come to a range of BMI which is like 18 to 22 to go into our next stage of overweight or obesity. We need to have a lifestyle changes at this stage itself to prevent the onset of obesity. So thank you.